Do you know what asthma is and how it affects millions around the world? Asthma is a chronic condition that affects the airways of the lungs, causing them to inflame and narrow. This leads to difficulty breathing, coughing, wheezing, and shortness of breath. With an estimated 300 million people globally grappling with this condition, it impacts lives on a grand scale. But to truly comprehend the complexities of asthma, we need to delve deeper into its roots. Understanding asthma begins with knowing its causes. What causes asthma? It's a question many ask. Asthma, a complex condition, is often triggered by a mix of genetic and environmental factors. If you have a family history of asthma, your risk increases. Environmental elements such as exposure to tobacco smoke, pollution, and certain viral infections during infancy can also play a significant role. Additionally, allergies can trigger asthma, as substances like pollen, dust mites, and pet dander may cause inflammation in the airways. Now that we know the causes, let's move on to the different types of asthma. Did you know there are several types of asthma? Each one presents its own unique characteristics. First, there's allergic asthma, triggered by allergens like pollen or pet dander. Then we have non-allergic asthma, caused by factors such as stress, cold air, or exercise. Occupational asthma is another type, resulting from inhaling fumes or dust at the workplace. Lastly, there's nocturnal asthma, which worsens at night. Recognizing the signs of asthma is key to managing this condition. What are the signs that someone might have asthma? If you've ever wondered about this, here's what to look for. The most common symptoms include wheezing, a whistling sound when breathing, and breathlessness, which can be particularly noticeable during physical activity. Additionally, persistent coughing, especially at night or in the early morning, can also suggest asthma. Remember, these symptoms can range from mild to severe, and not everyone will experience them all. Asthma can be mild or severe, and it's important to know how to assess its severity. How do we assess the severity of asthma? First off, severity is determined by the intensity of treatment required to control symptoms. For instance, mild asthma might only need a rescue inhaler, while severe asthma might require daily steroid medication. In terms of diagnosis criteria, doctors typically consider factors such as frequency of symptoms, nighttime awakenings due to asthma, interference with normal activity, and lung function. Lung function tests are a key part of the diagnostic process. These tests measure how much air you can breathe in and out, and how quickly you can exhale. Doctors may also use a peak flow meter, which measures how hard you can breathe out. In some cases, additional investigations may be necessary. These might include allergy testing, imaging tests like a chest X-ray or CT scan, and testing for other diseases with similar symptoms, such as GERD or sleep apnea. Once diagnosed, the next step is treatment. How do we treat asthma? Immediate treatment involves fast-acting bronchodilators or rescue medications. These are inhaled medications that rapidly open up the airways, alleviating symptoms like shortness of breath and wheezing. On the other hand, late treatment, also known as long-term control medications, works to manage the condition over time. This could include inhaled corticosteroids, which reduce inflammation, or leukotriene modifiers, which block the chemical reactions that lead to asthma symptoms. It's important to remember that each individual's asthma treatment plan is tailored to their specific needs. This depends on the severity of their asthma, their age, and their overall health. Moreover, the goal of treatment is not just to control symptoms, but to reduce the need for rescue medications and to maintain normal lung function. Asthma treatment is crucial, but so is understanding potential complications. What complications can arise from asthma? Well, severe asthma attacks can lead to respiratory failure, a serious condition that requires immediate medical attention. Chronic asthma may cause a decrease in lung function over time, but fear not, precautionary measures can help mitigate these risks. Regular monitoring of symptoms, avoiding triggers, and adhering to medications can go a long way in managing asthma. Remember, an ounce of prevention is worth a pound of cure. Managing asthma is about understanding it completely. To manage asthma, we need to understand it from all angles. In today's discussion, we've taken a deep dive into what asthma is, its causes, the different types, and the signs to watch out for. We've also outlined how to assess its severity, the criteria for diagnosis, and the investigations involved, not forgetting the immediate and late treatments and the possible complications. We've highlighted precautionary measures to ensure we're not caught off guard. With knowledge, we can manage asthma effectively and live a healthy life.